My day usually doesn't start till 10, so this is early for me, so I feel your pain. Has anyone ever heard of physical therapy? Yeah. Because I'm always impressed with high school kids, because I didn't know what I wanted to do till I was like 20 years old. So the fact that you guys even are in this class and trying to learn about what you want to do in the future is a good thing. So I've been a physical therapist for 5 years. I actually work at Excel on, you know where the Family Fair is over there? There's our buildings right over there. So right across the street, so you can hear the band playing sometimes during the day. But I'm just going to give you kind of a brief lowdown of what I do, and feel free to ask questions in the middle, and there'll be some time at the end of my talk before we do some demonstration with some fun toys like she said. So I just kind of wrote down a blank definition just as an overall of what a physical therapist is, and it's a healthcare provider who evaluates and treats individuals with various injuries, illnesses, conditions in order to restore mobility, improve physical function, reduce pain, prevent disability. So injuries, illness, just kind of people trying to rehab and get back to their healthy living that they were before. Pretty simple. As far as my background, I just kind of wrote down an outline just to kind of flow with just the normal education that you need in order to become a physical therapist. So you do your high school like you guys are in. I went to Marion here in town, so you do 4 years of that, and then I went to Creighton for undergrad for 4 years downtown and studied exercise science. I knew I liked science, health-related fields, and anatomy, that kind of stuff, so I just kind of studied a lot of human physiology, human science, and then physical therapy was just kind of a career that a lot of people in that major did, or that I was exposed to, and I kind of went around to different clinics and observed and just kind of figured out if this is what I want to do. So you do undergrad for 4 years, and then after you graduate, or before you graduate, you can apply to physical therapy school. So it's a completely separate program after college. Physical therapy school is usually 4 years, or 3 years, sorry. And at the end of all that, you get your doctorate in physical therapy. That's what your degree is called. So on my letters it says PT, DPT. That just means of the degree that you got. And then hopefully after you go through all your schooling, and some of it's coursework, a lot of it is clinical work. So you go out to different hospitals or clinic settings and work with patients, just trying to get a real world idea of what you need to learn, what you need to know, and everything. And then you take a big test, and once you pass that, you're a physical therapist, hopefully. And then a newer thing that you can do recently is get a specialty. Have you guys heard of like residencies for med school? So you go through med school, and then say you want to be specialized in like cardiac care or orthopedics, dermatology, all that kind of comes after med school. So there's also specialties after physical therapy school as well. I think a lot of people, I work in an orthopedic clinic, so that's kind of what people's firsthand knowledge of physical therapy is. You know, you sprain your ankle or you have surgery, that kind of thing, and you rehab back to normal. That's a very common physical therapy setting, but there's also, you can work in a hospital or work with people with major like brain injuries, spinal cord injuries, things like that. So you can also get your specialty in a topic or a certain population, little kids or elderly population. So lots of different options after school too. So then, who or what do you treat? Kind of touched on a few things there, but we work with athletes, not in my clinic, but other settings. You can work with individuals who have had head or spinal cord injuries, or amputations, burns, so more severe injuries. We do get some people that have had car accidents. Maybe they hurt their neck, or they're having headaches, or hurt their back or something. So we get some of that. Children with congenital conditions, that just kind of means some kids that are born with certain things. Maybe they have developmental delays or some other medical issues going on, and they need kind of care right away from birth. You guys know what the NICU is? Like when you're born, like the little babies. I did one of my clinicals and we worked in the NICU. You're probably thinking, what do you do with a baby for physical therapy? But a lot of it is just kind of exposing them to certain stimuli and just trying to get them to develop normally, since they're so small. So all age ranges that we work with. We also work with people that have had heart attacks or strokes. obviously their physical condition has declined after they've had something like that, so we get them back to normal. And then most of what I get in our clinic is just general population with a recent injury, maybe surgery of some sort, or chronic pain. So lots of different things. I just get a person in my clinic and back pain, or they had surgery a week ago, and then we kind of figure out what to do with them. So lots of different variety, which makes it fun. So where can you work? This is not my work, but this is just kind of a typical physical therapy gym, I would say. They have them in hospitals, they have them like in my building too. So I work at an outpatient clinic. It just means separate building, not associated with a hospital or any rehab center or anything like that. So that's kind of where I work. You could work in a rehabilitation hospital or center. People that are there just for physical therapy, so they spend the night, they kind of stay. It's kind of like a hospital room, but then they go down to therapy every day until they can go home and be independent on their own. There are physical therapists that just go to patients' houses. So say someone had a knee replacement and they don't have a ride to go out and get help somewhere else. They can live on their own, but they just can't go to and from their house. So some physical therapists just go to people's houses. Hospital, I mentioned. Schools, kind of going back to more of the kid population. That's kind of where you'll see it more in elementary schools. Kids that'll maybe be pulled from their class for 30 minutes or so every day, just to kind of work on developmental stuff, coordination, strength, things like that. Skilled nursing facilities, those are kind of more like nursing homes. Or you can work in like an athletic department or with a team. You guys probably have a training room here, I would imagine. So some schools, maybe universities, or professional teams have like a department where they have a rehab clinic in their facility, in their building, to just help with those athletes that are there. So lots of different variety. So what do we do? Treatments used. A lot of it is kind of exercise stuff. So you saw that picture of the clinic. So we have a lot of machines, a lot of exercise equipment just for strength training, range of motion. We do a lot of hands-on stretching. It's called soft tissue or joint mobilization, just kind of working with muscles or joints to help restore mobility, get rid of pain while you're moving them around. We do a lot of patient education, kind of say we're teachers or coaches just for exercises at home that we might want to have them do, or training them to walk with crutches or a walker, or teach them kind of stuff that they can do at home on their own to help relieve their pain in the meantime of coming in to see us. I mentioned assisting individuals to walk again, so walkers, canes, maybe they had a big surgery and they don't know how to walk properly, so we just have to kind of reteach them to go about their normal day. We do balance training, just general conditioning, aerobic activity, and then kind of have this fancy word, it's called modalities. It just means like I brought one of them in here. It's just kind of machines or different treatments that we can do in the clinic to help alleviate pain or get blood flow to a joint, a certain area. So I mentioned electrical stimulation. That's kind of this little device that I brought here. I'll show you that. You guys heard of an ultrasound? You've heard of like a baby ultrasound that has a picture, you kind of look and see, but ultrasound in our clinic is more like a deep heat. It's kind of a wand device, so we'll kind of use that. Ice, heat, and anti-inflammatory treatments. We have some topical medicine that we'll do with the ultrasound, or we have some patches that have pain medicine on them, or an anti-inflammatory medicine that just kind of gets absorbed into wherever you're putting it on your body.